Well, speaking of malaria and cell phones, a non-profit organization uses mobile technology to ensure that essential medicines do not run out at the health facility level in the United Republic of Tanzania. SMS for Life is a public-private partnership and a rollback malaria initiative. Joining us via phone from Switzerland is JIm Barrington, Global Program Director for SMS for Life. Mr. Barrington, welcome to the program.
Thank you very much.
Tell us, how does this work, using text messages to help in the fight against malaria?
Well, it's a mixture of a technology and a process which is designed to bring visibility of medicine stocks, as you said, at the remote health facility level. It uses text messaging, mobile phones, a web application, and Google Maps. And each week, health facility workers are requested to text in their current stock levels. These are then stored in a web-based application and are made available then via internet or smartphones or email to district medical officers and medical stores. In the case of Tanzania, they have about 5,000 such remote health facilities covering about 40 million people. And up until now, they would have had no way whatsoever of knowing how much stock of any medicine existed in any one of these 5,000 health facilities.
Now, considering this seems to be very much a technology approach, how is this working on the ground if you go to remote areas where sometimes there is an issue in terms of finding maybe internet connection or a computer? Yeah. How does it work?
So we have built this. Obviously, we needed a solution that could work in this very, very difficult and hostile environment with no electricity, perhaps no internet, only very basic phones and varying literacy levels. So we designed a system and a technology that, with the exception of the health worker's cell phone, everything else is located outside of the country, and it's offered as a service. So all that countries have to do is actually subscribe to this service. And the concept we used was very like, say, Facebook or Google Mail or one of these. So it's a central service that operates out of a large data center and just needs countries to subscribe to. So this solves the problem of local support, availability of skills, ongoing maintenance, technology, refresh, etc. And we have found that most areas, and certainly all health workers, all of the 5,000 health workers in Tanzania, do have their own mobile phone. So they use their own personal mobile phone. We don't supply them with computers. And at the health facility level, they do not require internet access. The district medical officers who manage the stocks, they're at district level. They do have internet connectivity. Consequently, they can view the data anytime they wish.
Mr. Barrington, that's all the time we have for today. Thank you so much for joining us, and good luck in this program. And that was JIm Barrington with SMS for Life. Dimiake?
Well, that's interesting how we had Makori talking about the medical ways being fought, and now this technological way of being fought, which is, I guess, accessible to so many people.
Interestingly, cell phone here are used to save lives, as opposed to the issue about
usual
cancer.
chatter. All right. Thanks so much, Linord Moudou. It was nice to have you on a longer segment today. Please be sure to watch for Linord Moudou every Tuesday and Thursday right here with the latest health news from Africa on In Focus.